evening and happy Wednesday. Welcome back to Health Plus Weekly. I'm joined tonight with our co-hosts Peter Kohenna and Hannah Raymond. We also like to welcome Sue Sherman from the physical therapy team at Southcoast Health. We're going to be talking about, kind of the common ailments of, pain, strains, and all the good things that come about this time of month when we're all going back to the gym and trying to get back into shape. We hope everyone made it through the storm okay, and everyone has their power back on. We continue to like to thank everyone for watching and joining the show. Last week was a personal almost record for the show. Nearly 11,000 people tuned in and watched. We really want to thank people for that. We want to thank you for the shares and the spreading the word, and please continue to do so that we can increase our awareness of lots of topics that people have. Again, we're going to be talking about physical therapy, kind of common aches, pains, and things that you may have, so feel free to send your questions in via Facebook, or Josh, our producer, was going to put up on the screen a number that you can text the questions into anonymously if you don't want to have your name associated with your question. We also take questions on all medical fronts that we will try to help and assist you with, or if we can't, point you in the right direction. So without further ado, let's Sue, tell us a bit about physical therapy. You've been with Southcoast for 6 years now, and kind of what do you see this time of year in terms of what are people coming in with?
Well, I want to thank you guys for having me on. This is great opportunity for us to get the word out.
Yeah.
That Southcoast is doing some great things in health and fitness department. So as a physical therapist, we treat anything and everyone from infants to geriatrics. About this time of year, like you're saying, Doc, is a lot of those. I'm going to get back to the gym. This is my year.
Yes.
2018's it. I'm gonna lose those 30 pounds. I'm gonna run the Boston Marathon, and those are all great intentions. And it's doing it properly, doing it safely, so that you can sustain to the long haul.
Yeah.
And not going out and being gung-ho and trying to do too much. Because what you find is that when people go out and try too hard, they kind of ramp up, they get sore, they say, this is it for me, and they stop doing anything. And with any type of exercise, you really need to work into it. So you're going to have some muscle soreness and some aches and pains, and those should be expected. And really, those should be hurrahs. That means that your muscles that you're trying to exercise are working.
Okay. I'm going to probably jump into just the first one that Hannah and I, as primary care, kind of clinicians, see: low back pain.
Ugh.
I mean, 2/3 of adults at any time in their life are going to have low back pain, once or maybe not more. We send a lot of people to physical therapy.
Yeah.
You are lifesavers for our patients and for us to help them get through it. What can patients do to prevent, kind of protecting their back? Ideally, we try to prevent as much disease as possible. So what can we do to protect our backs first, not to try to avoid any injuries?
Right, great question. So I often say to patients, the major crux of back pain is your front. And staying fit and exercising and maintaining a healthy weight. Really a lot of it is about, we do a lot of education at the Brain and Spine Center. So we have multiple physical therapy sites from Portsmouth, Rhode Island down to Wareham, and the one that I happen to be at is the Brain and Spine in Dartmouth. And we do a great amount of education for patients of stretching and a lot of core stabilization activities and strengthening. And really, you have to strengthen your back. Your back is made of some of the largest muscles we have in our body, obviously, and you gotta get them strong. So to baby your back, so to speak, and not do it because I have a bad back, really, and many times ends up driving you down the wrong road because you get weaker and weaker and weaker. So you really gotta safely strengthen. So, we do a lot of stretching, a lot of abdominal strengthening, a lot of low back strengthening, a lot of safe lifting, a lot of those kinds of activities. And people can do them at their home. They don't need to go to a gym.
Yeah.
You can use your own body weight.
Have you ever hurt your back?
Yes. hurt my back not too long ago. Actually, I was
Back to the gym, like you
no, so
said
I actually
you were
wasn't the gym. So I used to be a pretty steady gym guy. I mean, I was in the gym for at least a year straight up until this fall when I kind of fell out of the habit. Bought a house.
Yeah.
Started to get a lot more work that I needed to do at work, and you know, with all those new responsibilities, one of the first things that went was my gym time. But prior to that, I was deadlifting probably a little bit more weight than I probably should have, and felt the tweak and couldn't bend over to tie my shoes for about 2 weeks. Thankfully, it kind of cured itself. But I was worried for a little while there that things wouldn't get back to normal.
Yeah. How about you, Hannah?
here and there, yes. And I was just thinking one of the common things that I always try to convey to people is after a kind of an acute low back injury, how long it can take to really, see some good progression and kind of feel back to your baseline. Could you talk a little bit about kind of generally how long you can expect? Because I think it's much longer than most people think it will take.
I agree. Like with any muscle strain, but it's specifically with the back because of, I think, just the amount of soft tissue and a lot of the nervous system that's in there. We tend to get inflamed pretty quickly, and that takes a long time. So it's not, when we're in our 20s, it's a 1 day, 2 day tweak in your back. And as we get a little bit older, those could become 1 and 2 weeks or 1 and 2 months. And there certainly are things that we can do: ice, heat, stretch, rest when appropriate. That will help shorten that. But it really can take a good 4 to 6 weeks, sometimes for an acute back strain, to kind of self-resolve.
Yeah, that's what I try to tell my patients, depending on. But there are. And we can talk about them in a minute, there are major, kind of serious things that can cause back pain, and then there are not so serious and kind of more common causes. Can you talk about the anatomy of the back? Like there's discs, right? There's bones, there's nerves. How do they, where's the pain come from? Kind of sources, when people say like, oh, I have a bulging, what I mean?
Right. So most of the pain actually comes from the soft tissue. Okay. So the discs are shock absorbers between the bones. So we have 36 vertebrae, little bones that go from cervical down to our tailbone, and in between each one we have a disc. And the disc on the outside have kind of like a hard a ring around it, so to speak, an annulus. And on the inside is more like a soft, mushy kind of substance, I think would be the best to call it. And as we get older, that mushy substance dries out a little bit, and that's where we shrink, because that mushy substance starts to become compact. And then when you get an injury that can press down on the nerve root, that's when you get in the leg pain and the burning and the numbness and the tingling. But all of that is covered over with soft tissue, this fibrous fascia, kind of, if you think of a boneless breast of chicken, a boneless, skinless breast of chicken, and you can pick up that see-through kind of layer, that fascia that really holds us together, and then muscle lying over that. So there's a lot of deep tissues that can get injured, but most often we see a lot of muscle strain, a lot of soft tissue strain that gets inflamed and swollen and starts pressing on nerve roots. Yeah,
like you said before, because there are a number of muscle groups that actually keep us upright. Mm-hmm. There are muscles that go along kind of parallel with the spine. There are ones that go perpendicular to the spine. There's the quadratus, that kind of anchor arc. Right. Yeah, so there's a lot of things that can go wrong. Can go wrong and cause them.
Right.
Yeah.
So I just wanted to chime in quickly, say that we've got a few questions. And I just want to let Wendy know who we have a question from, and then we have an anonymous question come in. We will get to those questions shortly. We're going to discuss a few more things with Sue, and then we'll start taking the more general questions. So fear not, we're not ignoring you, and we're not forgetting about you. We will get to these questions shortly.
Hannah, can you talk about maybe some symptoms that maybe should make people seek care sooner rather than later in terms of red flag symptoms?
Sure. So we always love to see people in primary care kind of after an initial back injury, and that's oftentimes how they first present to us. And before we get to the long haul of the rehab that we then kind of involve Sue in, we do like to just make sure that there's no really alarming findings that would kind of warrant a more expedited workup and maybe a bit more quicker intervention. And certainly, some of the things that we think about are, any signs of, first of all, like infection that could be kind of in the lower back. So any fever, chills, any, recent procedures in the back, or, anything that could have caused some type of local abscess that could be compressing on the spine. Those are kind of few and far between, but still have to, keep them in mind. Another thing is a personal history of cancer. If somebody has had cancer in the past, is it possible that it's recurred, unfortunately, and seated in the spine and is causing those issues? The other thing that we worry about is any, you talked a little bit about that shooting pain that a lot of people describe as sciatica. The shooting pain down the leg that kind of, if you move a little bit, it relieves, and that's okay, at times, as long as it's kept under watch. But then, any numbness or persistent weakness in the legs, we really get concerned about. We'll do reflex testing if there's any abnormality there. We get a little bit more concerned about that. And then certainly kind of any bladder or bowel incontinence. We call that saddle anesthesia. So think if you're riding a horse, kind of where the saddle would go. If there's any numbness or loss of function there, that's, and I think that's important. We're always happy when people see us first, because we can certainly reassure them that you will get better in time. But if at any time during the recovery process you develop any of those symptoms, it would be an emergency to call us or right to the emergency room.
I agree.
Anything? Did I miss anything?
No, I don't think so.
Did I miss?
No, I think you did great. I think if you can't control your urine or your stool, or if you're numb in the groin, that can be an emergency.
Right.
And if your leg is not working or weak, you should get that addressed.
Dragging your leg sometimes.
Dragging your leg, yeah, absolutely.
Yeah.
Real pain that is really severe when you're lying down in bed. It kind of raises a red flag for me. Always, that's not good. So I need, and so no, I think those are all appropriate and kind of important things to know when you're kind of presenting with back pain. And after you kind of tease those things out, then it's, then you probably don't need an MRI, because the big question is, should I want an MRI? Right, a lot of people want to come in. So, your thoughts on MRIs and when you're thinking they should or should not be appropriate, kind of leads us into.
So what we learn in PT school and those red flags that we see are also causes for when we call you guys. So we get a patient that comes in with a general back pain, and over the course of rehab, now we're noticing that they're telling us that they're tripping, or they, a lot of time we'll have a foot drop. They'll hear like a slap when they walk, and people don't often associate foot numbness or ankle pain as being associated to their back, and so they go to a podiatrist because my feet are numb, and often we'll work backwards. For us, we kind of, we see MRIs more often ordered when they have radicular pain below the knee, or when conventional treatment has not worked.
When you say radicular pain, for people, what does
Sure. So radicular pain meaning pain that shoots down their leg or presents from their knee down to their calf and into their foot.
Okay.
So you can have that sciatica kind of pain, but it's just buttock or posterior thigh that may not be associated to a disc. It may be piriformis syndrome. The piriformis being a triangular shaped muscle that along your glute area, that the sciatic nerve either lies above or below or splits. And if that nerve is tight, or it goes into spasm, it can give you that horrific sciatic pain that people often think is a disc. And in fact, it may not be. It may just be a really tight muscle that needs to be worked out and stretched. So, for us, if a patient presents to us with any of that saddle numbness, bowel and bladder changes, inability to move, or incontinence, and that night pain or that pain that's just not going away despite position changes. Because whether it's soft tissue or discal, you usually can find some position that can alleviate or relieve a bit of pain. And when they really can't get anywhere,
Yep.
that's usually when we're on the phone to the doc and discussing, need for more diagnostics.
Okay, good. Outside of the back, Hannah, what do you think in terms of next common
Neck.
complaint?
Neck,
Or, yeah,
knee,
Sue,
shoulder.
yeah.
Neck and knee,
Yeah,
shoulder.
Sue,
yeah,
okay.
neck, knee, shoulder.
All right.
Is my,
Neck,
is
knee,
my
shoulder.
guess.
All
No,
right.
it's my guess,
All
neck,
right.
knee, shoulder, that's
Let's
what we
talk
say.
about- All right, so what do you think's next? What do you know?
My guess is neck, and you know who we're seeing a ton of neck pain is young kids. It's that texting, that
Oh,
head
no
down,
kidding.
gaming and texting. And I'm getting inundated with 13, 14, 15, 25-year-olds that are coming in with neck pain, and their posture is here. And when you kind of, what kind of sports do you like to do? What kind of activities? No, I don't do that. No, what do you do? Well, I'm hanging on my phone. I'm a YouTuber. I do a lot of blogging, and
Really?
and it's a lot of head down. That and thumb injuries. My hand team is crazy with tendonitis of the thumb from texting. Texting thumbs.
So, besides not looking at our, so just,
Mm-hmm.
what do we do to protect our necks? And what do we tell for parents looking, for their children to protect
So,
their necks?
posture.
Like slouching here, right now.
Yeah, good. As we all stop suddenly
Yeah,
shifting our seats.
Yeah.
One thing I suggested to parents is to get those physio balls. Remember when we were kids, they had those hippity hops? And they're a great, inexpensive way to have your kid work on their posture. Because you can't slump or you're gonna land on your tush. And you have to sit up tall. You have to engage your core. So we do that. And also backpacks. These kids have the heaviest backpacks. They're awful. They really are so heavy, and
two shoulders on the right.
two shoulders,
Keeping
not a
the-
wheelie, not one slung
Yeah,
sideways.
my
the
son and
two
I,
shoulders.
we argue every day. Like, put those straps on your backpack.
So much cooler over
Dad,
It is
come
Not cool,
on.
Dad. Yeah.
You're so not cool, Dad.
No. We know that every day of the week and twice on Sunday. How not cool I am.
But it's okay because that kind of comes and goes, right? The fad in a few
fad,
years will
that's
probably
it.
be two shoulders.
Two
again.
shoulders,
So
right.
that's good. That's
Yeah.
good for healthcare reasons at some point. So we just gotta wait for that to come back.
So, and in terms of older,
Degenerative disease, a lot of osteoarthritis, stenosis. So again, in the older age group, in which older is getting older and older every year as I
Absolutely.
move older and older. But they kind of lose fine motor control and finger dexterity, and I can't open the can of olives like I used to, and suddenly, they realize their hands are numb and their arm strength is weak, and often they will be developing a lot of stenosis in their neck. And so stenosis meaning the narrowing of the bony hole that the nerve root goes through, and causes pressure on the nerve that goes down your arms, and you get numbness and tingling and weakness.
And what's great about physical therapy, and you can correct me if I'm wrong on this, but postural changes and these kind of gravitational changes that occur, then that cause these symptoms, you can help people correct because you
You
give
can.
them exercises to
Straighten up.
strengthen certain
Yeah.
parts of their shoulder and their
Right.
spine and get them upright, and some of these things go away, which is really nice.
And
Correct.
yeah, absolutely, and a lot of education. You think about your head weighs about 8 to 10 pounds. So I'll say to people, I put a weight in their hand and I ask them to hold it with their wrist bent back. And as I say, just hold it like that, and I go on with my eval, and after a couple of minutes, they're saying, "Can I put this down?" And I say, "Well, that's what your head's doing. That's what the neck muscles are like. And now let's put it up like this and stack it back up on the structure. Suddenly, they can hold an 8-pound weight like this all day long, and it really kind of clicks.
Okay.
That posture is really the key, and can really fix a whole lot of what ails you. If you just kind of sit up tall, get your core muscles, meaning your belly and your low back muscles, strong and tight, and squeeze those shoulder blades together,
Okay.
you can feel a lot better.
I have a lot of patients ask about how a new pillow can affect their neck pain.
Oh,
Do you
right.
have any recommendations, or do you see that, and do you recommend that?
I wish I
physical
could,
therapy?
find a pillow that worked, because what works for one doesn't work for
For
other.
another, okay.
But certainly, I don't know what you recommend, Doc, or you recommend, but, we often recommend a small pillow
Okay.
that will give you support at the base of your neck. Again, it's about alignment and keeping you in that straight ear over the middle of your shoulder, over your hip kind of alignment. So the people that lie on 3 pillows, again, are back in that forward head posture.
So how you sleep, does that affect the type of pillow that, so say you're a side sleeper or a belly sleeper as opposed to a back sleeper? Do you recommend a different pillow to someone in those situations? Because I know they make different
Yeah, they
pillows,
do.
right? For that, and I'm not sure if that is that just a marketing thing, or is that legit? Is that something that really helps? But
I think what she said, I think you want to be aligned,
Yeah, I think they
ideally.
help.
And I was going to ask you, it's a good question. What's healthier to be a back sleeper? We're going to have Dr. Curtis Mello on, who's a sleep expert, in a couple of weeks
right.
talking about this. I know it's not good is how I fell asleep on my couch last night, like
Oh, like
wedged in the
this, right.
side, and my 12-year-old woke me up, and I've been trying to stand up straight all day. But
We can help with that, Doc.
But keeping thank you, keeping your neck in ears aligned with your shoulder blades, I think is really important, because I think people wear too many pillows.
We often will tell people to try something really easy. Take a towel, roll it up into, maybe what's this, maybe 4 or 5 inch diameter, put it at the base of your pillowcase, inside your pillowcase. And then you kind of have a little bit of support. So when you're lying on your back, it'll support the back of your head. When it's lying on your side, you're kind of getting that side support. But it's all about kind of trying to stay in a neutral posture as best you can.
Switching gears a bit, we have a question that came in anonymously about back pain. Hannah, I don't know if you want to
Sure,
take
yeah.
it.
So just kind of looking at generally at the question, somebody asking about back pain after a motor vehicle accident, which must be something that you deal with quite frequently. And it looks as if this person has sought a lot of medical help, acupuncture, x-rays, and MRI, showing some degeneration of the spine and a mild prolapse in the back. And unfortunately, due probably to some mobility issues because of the back pain, has gained some weight and is now having more difficulty walking. Has tried, it looks like, aquatic physical therapy and chiropractic care, and is at wit's end. So kind of for somebody who's maybe done all of the right things, what do you recommend when you've kind of given them everything that physical therapy
The
can
one thing that
offer?
I'm hearing when I'm hearing that they've tried aquatics, which is a great medium for rehab in the pool. I'm not hearing strengthening,
Okay.
and often that is the hardest thing, because it's hard to start to strengthen. It hurts and people stop, but you gotta kind of start slow, keep building, stick with it, work with your therapist, talk to them about, you certainly don't want to progress somebody too quickly, but you don't want to progress somebody too slowly either, because strengthening takes time. And it takes a lot of repetition, and that's the one thing I hear in that story is I didn't get on a good strengthening program. So I would encourage them to speak to their physician or their therapist if they're still in therapy about getting on a good core stabilization and exercise, knowing it's going to be tough. It's not going to be easy, but if you give it a couple of weeks and when it hurts, just back off a little bit and then go right back at it the next day and try to work through some of that pain. We have a program which I know you're aware of because we see your patients over there, our functional spine program.
Yep.
And our functional spine program is actually designed specifically for people that have chronic back or neck that have gone through the gamut, including surgery sometimes, including injections. And basically we say, okay, so you've got a back that's degenerated and you've got 2 herniated discs, but you're not a surgical candidate. You don't want to live like this. You don't want to be taking meds for the rest of your life. So we're going to work to get you as strong and as flexible as you possibly can be. And we have great results. It's hard work. It's hard work on the patient.
Can you mention that program one more time?
Sure. It's called the Functional Spine Program. It is at the Brain and Spine in Fall River on 235 Hanover Street, and as well as the 480 Dartmouth at the Brain and Spine Center in Dartmouth. And it's designed by a group of physiatrists in cooperation with physical therapists. The original one was done by Jim Rainville, who's a physiatrist at New England Baptist Spine Center 30 years ago. And we have kind of taken that model and kind of put our own spin on it. And the main purpose is to work on function, stabilization, strengthening, function, range of motion. So we work a lot about what can you not do that you want to do, and helping you get back to there.
That's great. So, if someone's interested, they can go to southcoast.org and
Correct.
look up search for that program,
Yep.
and they get all the contact information.
It's on southcoast.org, either in the rehab section or on in the neurosurgery section at the Brain and Spine. If you look up the Brain and Spine on southcoast.org, you'll find information about it.
So I think this would be a great time to take our first short break and then come back and we can answer some of these. We had a number of great questions that are here. We can come and answer some of these general questions and then maybe get back to talking with Sue a little bit more about some PT and movement things. So this is a 30-second break, and we will be right back again to start answering those questions. So stick around, and we'll be right back with you.
People, actually come up and they're like, I gotta hug you. And it's like, this is the first time in, X amount of years I've not been in pain. And we get that feedback every single week. Integrating the nurses, integrating physical therapy, that is all part of the treatment strategy, the treatment algorithm. In a matter of weeks, matter of months, they're now able to have the life that they want to live. And that's really more than medicine.
Hey, welcome back. So we'll start with some questions here. First question that came in was from Wendy. Thank you, Wendy, for your patience. She is asking, she just got diagnosed with stage 3 chronic kidney disease. First, her question is what exactly is it?
Sure.
And I imagine she's probably also wondering what can she do about it.
Great question, Wendy. So our kidneys serve many functions in our body. One of them is to filter our blood and remove certain parts of it, whether it's sodium, potassium, different toxins. And when we look at diseases of the kidney that affect its ability to do that, and how well the blood's moving through and how well it's filtering our blood, we rank them from normal kidney function up into kind of stage 5 kidney diseases, which when people are on dialysis. And so stage 3 kidney disease is kind of in the middle. It's whoever diagnosed it did a good job in finding it for you, because it's at a time where you can intervene and figure out what's causing it. What can cause kidney disease? Perhaps the most common thing that injures our kidneys is high blood pressure in this country. It's one of the unfortunate things that you can have high blood pressure and not know it, and it can damage your kidneys. Other things that can damage our kidneys is diabetes, also a very common thing in this country, so make sure your blood sugars have been checked. Other things that can cause it, certain medications can injure our kidneys. There are hereditary factors that we are born with that we may not know that can damage our kidneys. There are infections that can damage our kidneys. There are diseases that when your body kind of attacks itself, or autoimmune diseases such as lupus, that can damage our kidneys. So in the type of doctors that look after your kidneys, you may not know, are called nephrologists. And we have several really great ones in Southcoast and Wareham Market, Fairhaven, New Bedford Market, Fall River, and also I believe in the Quidnick Island Market in Rhode Island as well.
Any particular nephrologist that you like to refer your patients to?
So I have the pleasure of working with Dr. Sagar Patel and his colleagues in the Fairhaven building, who are fantastic and do a great job. And depending on where Wendy lives, she can talk to her doctor about getting plugged in, but I think the world of them. They're fantastic.
And great. And again, we talk about this every week, it seems like, but if you go to southcoast.org, right at the top of that page, there is a tab where you can click on for doctors and you can search by specialty. And it will show you where they practice right on that page. So just go there, look up nephrology, and it'll pull up every single doc that's in the system that is their specialty, and show you where they practice. We'll show you if they're accepting patients. For this, I imagine most are. So that's a great resource if next step.
Yeah.
So it looks like there's another general question about a woman with pelvic congestion syndrome and a history of hip issues, looks like from birth, lots of pain going along with both of these ailments, and just feeling like she's not getting the help that she needs from her doctor. And what can she do to just make the pain go away? I'm not personally familiar with pelvic congestion syndrome, and I'm not sure if it's related to the hip issues, but I think it kind of harps on what we talked about last week, that having a really good relationship with the person who's treating you is an important first step into kind of getting healthy and getting the care that you need. And I think that you would agree, maybe probably you too, that if just like in life, I like to tell people you don't mesh with everybody, and if you feel like you're not being listened to and would like to get a second opinion, I think that's reasonable if she feels like she needs more help than she's getting now, and I think that's understandable.
Have you seen anyone with pelvic congestion syndrome?
I haven't, but we do have a whole division of pelvic health physical therapy
Yes.
over at 300B on Florence Corner Road. Janet Gillis and oh my goodness, the names are escaping me.
That's okay.
Isn't that awful? But we have some really wonderful therapists that work with both men and women with pelvic pain and pelvic disorders. So that may be something to talk to her
I've treated a
physician
few
about.
women with pelvic congestion syndrome, and it's kind of just an excess amount of fluid in the blood vessels and the tissues that are in the pelvis and our pelvis bone is a pretty small space to begin with. So there's not a lot of extra room. So symptoms of constipation, pelvic pain, sometimes pain with intercourse or sex. It may or may not be related to the hip pain. We like in medicine to try to get to one diagnosis that's causing the symptom. There's one root thing. But sometimes it's not. Sometimes things are true, and unrelated. So I would also say to make sure that if your hips are bothering you, that you've been evaluated, that that may not need x-rays. Plate x-rays are a good, simple, safe thing to start to look at your hips. And the pelvic physical therapy group is excellent.
Yeah,
I've
they're
had
great.
patients, Janice Gillis, is that?
Janet.
Yeah, Janet.
Janet
And
Gillis.
she's fantastic and has worked with several of my patients. I believe she does some lymphedema work too.
She
doesn't
does. She does lower extremity lymphedema. I'm sorry, upper extremity lymphedema, as well as pelvic health for men and women. And they are, I can't say enough about how much they have helped so many of our patients. Often we'll see post-pregnancy or pregnant women with a lot of low back pain, and we'll treat them at any of our sites. But when they really get to the point that it may be beyond, then we send over to Janet for some specialty work, or anyone over at that group.
We're talking about backs and some, common aches and pains after the holidays, but Janet and her work with, especially women who've had mastectomies and have had lymphedema of their upper extremities is fantastic. So just to put that out for people who've my wife had breast cancer and had, double mastectomy and had some lymphedema in the one arm where some lymph nodes were taken out, and she worked with Janet. It was great. And there's a lot of women who can come back at various times. So that's another tremendous resource of our physical therapies department is.
And it's underutilized, unfortunately.
Yes.
Sometimes
women suffer,
women
I think,
don't
unnecessarily.
know.
Yes.
Yeah, exactly.
So to try to get that out there tonight, if you've had a mastectomy, if you have some swelling in your arm, to consider this because it can make a difference.
Right. And it's not only about seeing someone consistently to get the lymphedema down. It's a lot about education and garment wearing and things that you can do to prolong keeping that lymphedema away, and a lot of education and prevention. So, certainly if women are out there, or men, and they're having that persistent swelling post breast surgery or axillary surgery, certainly speak to your physician about some lymphedema treatment.
So we're actually working on a really great patient story right now that comes from Dr. David Gillespie in his vascular office. And he actually had a patient who who came in with similar problems, long-term pelvic issues, and what ended up being the cause was a vascular issue. And it escapes me the particular procedure they ended up doing, but she's now pain-free. So
Yes.
that's definitely that's one that I am familiar with through our work with Dr. Gillespie. So that might be a route that this patient might want to explore as well.
I think it's a common theme we talk about on the show is to listen to your body. Hopefully you have a relationship with your doctor. If you're not feeling well and not getting the answers, that more investigation, second opinions could be not, but you deserve that and to look, because sometimes a different set of eyes on the problem, sometimes just collaboration between other people is a good thing. So if you don't feel well, just advocate for yourself.
I agree.
So we just got an anonymous question about some stomach issues, and if you're still watching, who sent that in, if you wouldn't mind sending maybe a few more details. It's a broad question. I can certainly ask the folks here to answer that question generally, but if there's a more specific question, please send that along. The next question I could start us off on a little bit. It's symptoms of the flu that is going around.
Sure.
So I can tell you that I've been working closely with our infectious disease department on tracking flu, and over the last 3 weeks we have seen a consistent doubling of the numbers. 3 weeks ago we had about 25 patients who all season long had reported to our 3 hospitals combined. The following week that number went up to 50, doubled, and then this following past week reported as of this past Friday, we're almost at 100. So it is doubled 100% each week. So we are in the thick of at least wave 1. There seems to be a thought that this could be wave 1 of 2 waves, since we're a little earlier than our normal. But we are in the thick of flu season right now.
So being on the front lines in primary care and seeing a lot of the episodic sick visits, I actually saw a couple cases of confirmed flu today, so I can speak to some of the
Those numbers are going up.
Yeah, the numbers are going up. And kind of the common symptoms that I'm seeing are just a headache, sore throat, a scratchy throat more, fever, body aches, feeling like your hair hurts, like you've gotten hit by a truck. And then just a dry cough, and accompanied by some nausea and maybe a little bit of diarrhea as well. But there also seems to be maybe a separate stomach bug going around. But
Yeah, that's not influenza.
It's not influenza, but with the confirmed cases of influenza that I've seen, there's been kind of just mild GI upset, but not the full-blown vomiting, a little bit more of diarrhea.
So, great. People ask, regarding a fever too. So that people have lots of different questions about fever. Generally, most of us, not all of us, most of us have a temperature, a normal temperature of around 98.6. A fever, which you should raise your concern, is greater than 101 or greater than 100.5 repeated twice. If it's not going down. And some people have this, and your normal temperature is 96 and you go up to 98 or 99, that's a fever for you, so that's important to know. Children, I'm not a pediatrician, and the elderly actually have different thresholds as well. So we care for the elderly. Elderly I define as probably 75 plus, that they actually may not mount fevers. They can be very deceiving, so your elderly patients may not spike a fever. But
They can actually be a bit lower than normal, yeah.
But cough, sore throat, body aches, it raises the alarm. This time of year you should seek care, because we know that if you're treated early for influenza with antiviral medication like Tamiflu is the over-the-counter or the prescribed one through outpatient, it shortens the course of it. It can help you prevent spreading it to other people. Even if you were more than 2 days with those symptoms, you should still get treated. It can make a difference. Especially there are patients who are higher risk and who should really be on the lookout. People who have asthma, emphysema, and trouble with their lungs. People who have chronic illnesses of which they are, whether it's cancer that they're going through, or maybe they've had an organ transplant. Maybe they've lost their spleen to a motor vehicle accident or things. They are even at higher risk for flu complications. And we just can't let this episode pass without kind of advocating for flu vaccines as well. It's definitely not too late to get a flu vaccine. It takes about 2 weeks for the vaccines to work. We recommend them for anyone older than 6 months, I believe, up until there's really no stop on it, and it's important. And so we highly recommend flu vaccines.
So I would assume, Doc, that we're in the throngs of it now, but having just come out of the holiday season, where everybody is seeing relatives and
Oh, yes.
hugging and kissing and sharing a bite of this and a sip of that, and
It is a cold weather virus, influenza, so you don't see it in the summer, you don't see it in the fall, so as temperatures drop, it comes via the southern hemisphere, it's amazing how it just travels the world, and it absolutely, as people mix, mingle, fly, travel back, forth, it comes, yeah.
Our typical flu season here is February, March, so we're a little ahead of schedule. I'm not sure if that's a good sign that we'll get through it, or if
No, it's anticipated. The Center for Disease Control has put out numerous public health warnings. It is anticipated that we will have a heavy flu season, and to be on the mend for it. The Southern Hemisphere, Australia, had a very, very heavy flu season, and it's proving already such that the numbers are up. So
we got about 15 minutes left, and we have quite a few questions. So we'll try to move through these quickly, make sure we get to everyone. Question from Tara. Trouble breathing lately, can't catch her breath. I'm not sure how, from looking at her photo here, I'm not sure how old Tara is, but having trouble catching her breath. Looked up symptoms for asthma, but still not sure. Comes and goes. Having a lot lately. It's happening a lot lately. What could you be dealing with?
I mean, there's a huge host of causes for shortness of breath. Kind of as how we define trouble breathing. Now, certainly within that, there's wheezing or other iterations of that. But for shortness of breath, we kind of think of several different mechanisms that can cause it. It can be lung disease like asthma or COPD if or any smoking history. It can certainly be an asthma caused by allergies, or sometimes it's cold induced or exercise induced. So that's kind of one area where maybe the oxygen that's in your lungs isn't getting transferred to the blood quite as well. Another thing that we think about as a cause of shortness of breath is cardiac disease, and the heart either not pumping effectively enough to kind of cause the symptoms of shortness of breath, or kind of a variety of issues down that avenue. And then the third thing that I know that we kind of it gets lost sometimes is like an anemia, where you don't have enough kind of red blood cells and the components of those to carry the oxygen around, and you kind of get the sensation of shortness of breath. So it's asthma is certainly very common and it's very treatable, but I think it would be important to kind of parse out the different causes there, so you can kind of get to the bottom of any of those causes.
This question's an anonymous question. It's actually one of the first questions that came in, so thank you for your patience on this. The question is about protein S deficiency and antiphospholipid.
Phospholipid, yep.
Antibody syndrome. Worried that we'll have to be on Coumadin for life at only 39 years old. Is there any chance that home testing will work for the disorder? Is this something that you guys are familiar with at all?
Mm-hmm.
So we are both familiar with the antiphospholipid syndrome and some other of the disorders of our body that make us more prone to developing blood clots, which the protein C and S deficiencies are. We are not experts in kind of treating them, so I would definitely recommend our hematology, our blood specialists at our cancer center. It doesn't mean they have cancer, just that the cancer specialists also specialize in blood to determine the degree and the severity of the deficiency, because there is a range, and based on that will dictate treatment options, whether or not, how to protect you from clotting. And that's on our website, but definitely the Southcoast Cancer Center would be a perfect place to get further questions and great answers for that.
And the home testing part of that, I think, is probably related to warfarin monitoring. And there are, I do know, a lot of times it's dictated by insurance coverage for the actual durable medical good, the actual, device that tests your blood. So it would kind of be dependent on that, and also the preference of the person monitoring it, whether a home testing would be appropriate there.
Another anonymous question. Actually, no, it came in anonymously, but Terry signed her name to it. So the question's from Terry. Recent visit to dentist, had tooth extracted, roots infused to the bone, removed in pieces. Was very close to the sinuses. 2 weeks later, had to be checked because it was infected. Put on amoxicillin. Today, X-ray was taken. Looks normal, but sinuses are still inflamed. Inside cheek area is swollen, as well as glands inside of her neck. So she gets that call primary, go to ENT. I think that would be the suggestion as well. But is there anything more to that you would add?
Or oral maxillary facial surgery or oral surgery. I'm not sure who she saw. We do not have oral surgeons, but I would highly recommend, who I refer to as Dr. Mark Milano. He's an oral surgeon in the Dartmouth area. He's fantastic. He's meticulous.
He pulled 4 of my daughter's wisdom teeth this morning.
No kidding. No
He
kidding.
is the oral surgeon of the Sherman family. He's doing 2 more kids next week.
Yes. So I think she needs to follow up and see, kind of like, either her dentist or an oral surgeon if she has not seen them yet. Absolutely. To see what's going on.
So this looks like it was an honest question that came in from Mike, who had asked about his wife and the pelvic. And he actually asked a follow-up question back on Facebook, which I think is a really great question I want to make sure we got to, was how do you go? We mentioned, as we were talking about answering his question, that he and his wife weren't necessarily happy with the suggestions they were getting from their doctor. Mm-hmm. And we suggested a second opinion. Mm-hmm. Well, he's asking how do you go about getting a second opinion?
Sure.
Because his current doctor, they brought that up with the doctor, and the doctor basically has kind of dissuaded them from doing it. So what would you recommend?
So depending on whether it's another primary care opinion or a specialist opinion, the internet's a wonderful place to go in terms of searching for even just a name of a specialist, whether it's here locally or at a tertiary center, in either Boston or Providence, and that could be a place to start, and then kind of calling there to see if there's availability or anything of that nature is sometimes how people bring names to us of second opinions that they would like to see.
But a patient has the right to pick up the phone and call any doctor.
Yeah, the only rate limiting step may be a referral, depending on if they have an HMO or not, if they need a referral. But outside of that, but you should feel comfortable. So you can research them on their own, like Hannah said. You can go to the local organizations like Southcoast.org and find our docs about. You can search for kind of disease site that's bothering you. All the academic centers up in Boston or Rhode Island are excellent places for second opinions as well. So yes, absolutely.
There is a movement that is happening in medicine where systems want to keep patients in their system. So doctors will only refer to patients in their system. I honestly feel like at Southcoast we do a great job, that our doctors are going to send you to whoever they feel is the best doctor to treat you, whether they are a Southcoast Health Doc or not. But if you are getting flack from your doctor, whether you're a Southcoast patient or not, you have a right to contact your insurance company, get a list of doctors that are covered through them, and regardless of what system they work for, you can contact them and get a second opinion from them. It's your right to do so as a patient.
Absolutely.
So there can be other factors to why your doctor is recommending you to certain people per time. So I think that's important for people to know.
I think it's also important that if you really need to have that kind of a relationship with your primary care, that if you're not comfortable, maybe you need to think about other primary care.
Right.
And it's really important to have a cooperative relationship with your physicians and your therapists and your, who.
And a lot of times I have patients who say like, oh, I worry about hurting your feeling or the specialist. You're not hurting our feelings. We all are in
want
this
you to get
because
better.
we want you to get better. We want patients to get better. So don't worry about our feelings being hurt. We want the right, we want the right diagnosis. We want you to get better. We had that general question that came in about stomach pain.
we can put that on the list maybe for something we can talk about next week.
Okay.
Because we're running a little short and we still have a couple more specific questions to get to. So here's one from Michelle, who's been having anxiety attacks. What can she do?
So, talking about anxiety, depression, kind of any of those general issues, you would want to. There are a couple of kind of organic causes, like if your thyroid is off, sometimes that can cause you to be more anxious than normal. So I would recommend kind of getting that checked out first, just a general. Sometimes if you're having heart palpitations, that can be construed as anxiety. So, talking with your provider about some of the organic causes of anxiety, and then we kind of it's always a nice conversation that you have in primary care, where you get to spend a little time with somebody to kind of figure out what's surrounding the anxiety, whether it's just situational, are you under more stress than normal, is there a chance that it's going to pass, or is this a longer standing issue that may require a bit more work. So we first and foremost like to just recommend kind of changing things, whether it's caffeine and a little bit more mindfulness and deep breathing and kind of stretching and getting in tune with a little bit of your body's cues. We like to avoid medication as much as possible, but certainly there is a place for medication when it comes to anxiety, especially if you're having debilitating anxiety attacks. So
We use a lot of exercise to get those natural endorphins that often if you're not an exerciser and you start to even just do 10 minutes a day, you start to retrain your brain to start to emit those endorphins, which is our own natural chemical in our brain that gives us happiness. And yoga, we use a lot of yoga in rehab, mindfulness, guided imagery. YouTube has a ton of great guided imagery that you can Google search as anxiety or depression, ones that really can be very helpful.
Things that are just generally good for us that also work very well for anxiety. Getting a good night's sleep, making sure you're getting enough sleep. Everything's easier with kind of 7-8 hours of sleep under our belt. Eating well, watching the caffeine like Hannah said, and yes, quieting your mind via some sort of meditation is really game changing. I like the Heads Up app. I use it a lot. I recommend for my patients. Calm is another one of your phone.
Yeah, I've used Calm.
YouTube. It just is simple. It doesn't work. It's not. But it gradually just helps you.
Yeah, Michelle. We've talked about this on past shows. I've suffered from anxiety attacks for 15 years since I was in college, and just recently, in the last few years, really got it under control myself. So this is from my own personal experience. I can tell you, one, there is hope and they will go away. I know when you're in the middle of that and you're in the middle of a panic attack and if they're going on for a while, you feel like this is how you're going to be for the rest of your life. No, you don't have to feel that way. There is hope, trust me. I would say first thing, don't be embarrassed. The reason why I always have to talk about it is because I feel like that stigma is weight that you carry on you. I know I went a year of my life when I first started suffering from anxiety attacks without telling anybody because I didn't know what it was. I was embarrassed about it. I thought as a guy in college who played football and was in really good shape, why is this happening to me? This shouldn't be happening. I was embarrassed, didn't want to tell it. Finally got to a breaking point where I had to talk about it. And I'll tell you that the relief that comes off of your shoulders when you can talk about it is huge. As you guys talked about, exercise, mindfulness, meditation, those are all great ways to really help. Go talk to a therapist. SSRIs, I've been on an SSRI for a while now, and it really helps kind of keep the edge off from me. And as you mentioned, YouTube is a phenomenal place to go to get guided meditations. If you haven't meditated before, it's a great place to start. They walk you through the meditation process, keeps you engaged, teaches you how to do it, and then you can get to more advanced stuff down the road. But meditation is an absolute game changer for me. It helped me to find my base and my center, and whenever I get anxious now, I just go back to my breathing, and it really helps. So throwing a lot of information out there, but Michelle, just know that you're not alone here. Tons of people. I can't tell you how many people I've talked to that suffer from something similar, and there's always hope there. And you can always reach out to me. I'd be happy to talk as someone, as a non-clinical professional, but as someone who has gone through. You're always welcome to email me or contact me on Facebook, and I'd always be happy to tell you what has worked for me personally.
Do you have anything left in the queue, or?
Yeah, so real quick, because I know we're right up against it now. From Cecilia, Power Walker. Starting in September, can no longer walk long distances. Left leg is weak. What could it be? Trying exercise, but it's not helping.
So it can be a variety of things. Specific of left leg is weak. So one thing that I often have people look at is what are their footwear? Have they changed their footwear? Have they changed their surface of what they're walking on? Is there anything else besides the weakness? Because weakness in and of itself doesn't generally just happen. There's pain, which causes weakness. There's an injury that causes weakness. There's back issues that give you that weakness down the leg. But to just develop weakness on its own is a little bit atypical.
Yeah. And it's hard in not knowing all the full symptoms. I would say something that happened to me personally, and once you realize something happens to you, it happens to many people to be a look at, is I was training for the marathon, the Boston Marathon last year, and I hurt my psoas muscle. Mm-hmm. And I was having hip and left leg weakness. And I was in agony, and it prevented me from training. And I was actually Darnell, one of the physical therapists, who diagnosed me and helped me get out of it. So,
But did you have any psoas pain?
I didn't know what psoas pain.
At the time,
I'm a doctor.
right.
I'm embarrassed to say this. Like I didn't even think about that.
Right.
I didn't know. I just knew it was hurting. You know what I mean?
Right,
I thought it was my hip. You know what I mean?
But usually people have pain and not just weakness.
Yes.
So that's kind of a little interesting.
Generally, just so they can follow up, who should they talk to?
Well, I always start with primary cares.
Yeah.
Those guys are the best. They know you the best, and I would start there and then work from there with them and to see if they then refer you to ortho or if they can just,
And is that something concerning enough where they should definitely make that phone call?
I think so. Weakness is just
Gone
not
on
normal.
long
Yeah,
enough.
we shouldn't be
Right.
weak.
Shouldn't be weak without a reason, and it's gone on long enough.
Yep.
So our final question we'll tackle tonight is from Regina. She's been lightheaded for almost a year now, she said. And it sounds like she's gone through a lot of testing. Everything's come back negative. The only thing they've discovered is that she has a vitamin B12 deficiency. Taking injections, levels are back to normal now, but still lightheaded. She's never felt like she was gonna pass out. It's usually just a feeling off balance or weak. Mm-hmm. Any ideas of?
So it's a very common complaint that we see a lot in the office. And it can be, unfortunately, caused by a myriad, or a number of things that can cause it. Mm-hmm. Some of the most common, starting simply, dehydration. Mm-hmm. So depending on if you, just making sure that you're getting adequate fluid intake. A lot of people don't. So symptoms of dehydration dizziness is it worse when you go from a sitting to a standing position?
Tunnel vision.
Tunnel vision can be, or it also kind of coupled with fatigue. A very common thing that makes people not feel so great is whether they're on blood pressure medications or not. Blood pressure medications are fantastic. They do a good job of lowering our blood pressure, then reducing our risk of strokes and heart attacks. A very common side effect of them as well, though, is some dizziness that you can get when you go from a sitting to a standing position. So a lot of time with my patients regarding what the symptom is, we often ask them, did you start a new medication right around the time the symptoms started? It's really good to look at. Also in your life in general, if something started, just try to take an inventory of what perhaps changed right before it. Did you start a new medication? Did you start a new diet? Did you gain or lose weight? Did something happen at work? A variety of things could cause it. There are more serious things that can cause you to be dizzy or off balance in the brain, perhaps, that may require an MRI to look at to see if there's maybe poor circulation in the back of your brain. Is there something on in the tissue of your brain as well? So I'm sorry that we can't answer it specifically, but I hope we gave us some ideas of what you may or not have looked at and some other things that you can perhaps discuss with your doctor.
And another related question from Anita. Sorry, Anita, I apologize. Josh just passed over his phone with your comment, and for some reason it wasn't coming up on my phone, either of them, which is strange. But Anita was actually the first one that had asked about lightheadedness. And so what's different about her question is that she said that it started around the time when she felt a pop in her neck.
So that makes me extremely worried in the sense of to be evaluated because there's a lot of circulation in our neck. There's a lot of blood vessels that go up to supply the back of the brain, and that might be almost more of a red flag symptom to me that I would recommend some sort of imaging that looks at those blood vessels, whether it's a CAT scan or an MRI. So Anita, we apologize for not addressing that earlier. Thank you, Josh, for bringing that up. I highly recommend that you seek out care. If you couldn't, even tomorrow, to get that looked at.
That's all we got for questions this week.
I feel like it goes faster and faster each week. I think the hour goes. Any closing comments, Sue?
I just want to thank you guys. This was really fun, and I enjoyed myself. And if anyone has any questions that you didn't get a chance to ask, you certainly can feel free to call the office at 508-973-9115, and I'll try to help you out. If not, to direct you to someone who can. And again, I'd like to thank you all for allowing me to come and spend some time.
That's great. And just a quick technical note again, Anita. Sorry we missed you. For some reason, we've been noticing that on Facebook, not all the questions come across for some reason. We've run into this before. If for those, it feels like we're getting more and more viewers who tune in every week. So if you are a recurring viewer and you've asked questions in the past and for what we haven't got to your question, we try to get to every single one. So if we're not getting to it, it's probably because we're not seeing it. So try sending it to the anonymous number. Try texting it to us. I feel like we've had pretty good luck with getting everyone's questions through there. So try us through the comment section, and if after a little while we're just not getting to it, try us through that as well to make sure that we did get it. Because honestly, we're trying to answer every single question on here. We know that if you've taken the time to ask it, that it's very important to you, and we're certainly not ignoring any of these questions. We'll get to them. If it's something that we can't answer, we'll try to steer you in the right direction. So thank you again for really helping this show grow, and we hope that you'll keep tuning in and watching.
Thank you, Peter. Thank you, Hannah, for your coming back for another week. I'm remiss I haven't thanked Josh before, our producer, for putting the lights on here and helping us out. Josh, thank you. As always, if you like it, the show, please tell someone else about it so we can just spread the word. Please share us on Facebook. It also helps spread it out there. And for all those people who tune in weekly, we thank you very much. And we'll see you next week.